Hello, everybody. Here today with an excellent guest. We've got Heidi Lucas, who is the executive director of the Missouri Rural Health Association. And Heidi and I are going to be talking about the Rural Health Transformation Program today, what's coming out in Missouri, how Heidi's seeing providers prepare for it, and just to hear really what's going on in the ground in a very important state for this program. I think Missouri is going to get $260 million in year one, so above the average of around 200 million, and gonna be asking Heidi a few questions about the program today. So Heidi, if you could start, just let us know a little bit more about yourself and what you do at your organization.
Hi, everyone. Like Adam mentioned, I'm Heidi Lucas. I'm the executive director of the Missouri Rural Health Association. Our organization's been around for over 30 years, and I've been the executive director going on 3 years this year. So time flies. Prior to this, I was the executive director of the Missouri Nurses Association for a number of years as well. And I've spent most of my career in healthcare policy, advocacy, organizing, grassroots organizing, and such as well. So
Mm.
I really love the work that I do for our rural communities here. They are resilient and they are forward thinking, and we are excited that rural health is being brought to the forefront of the conversations going on in this country.
Yes, me too, and that's really what I wanted to open with, and ask you about how is this moment different than previous moments? Like, how is the Rural Health Transformation Program a real outlier in what came before in terms of funding for rural healthcare?
Yeah, so this is the type of funding that our rural communities, our healthcare communities have been asking for decades. We have been begging for this infusion of money to come into our systems to help support and stabilize as well as to grow and innovate. And so, it's hanging currently under the specter of potential cuts to other programs such as Medicaid in the future. But we are very grateful to be able to have this funds and be able to do some on the ground work to really help with systems change. And one of the big things about this funding versus previous funding is that historically, rural health funding has focused on kind of short term grants that are designed to address immediate gaps like staffing or equipment needs without changing the underlying system. And the Rural Health Transformation Program is different because it is intentionally focused on redesigning how rural health care is delivered and sustained over time. So here in Missouri, like you mentioned, we are receiving about $216 million in year one. We are very excited about that. I believe we're the ninth most to receive funding in the country.
Mm.
So we are receiving, quite a large chunk of it, and we're very excited about that. It really represents a significant shift in regional systems of care, workforce development, and long-term sustainability rather than temporary fixes.
Mm. Yeah, that's what it's all about. I think the temporary fixes have been too long in place, and they're just temporary, and money runs out and has to be. One provider told me that money gets thrown at it, and it just kind of fades away after a while.
And that's one of the big issues with just grants in general, right? Like a
Mm.
funder, the government or private funder will be really interested in the project that you're doing. And, they're kind of funding all of the bells and whistles, but it's for
Yeah.
a year or it's for 2 years, right? It's not
Yeah.
really transformational funding that will allow systems growth. It's really been programmatic as
Okay.
opposed to looking at the system as a whole, which is what this funding is doing.
Oh, amazing. Okay. So that is the big difference then. And I was wondering, in cross Missouri, there's probably a wide range of healthcare providers and rural communities. What types of organizations are you seeing would be best positioned to benefit from this program?
Yeah, so here in Missouri, the model that was laid out is based on a program that's been around for a couple of years called the Torch model. It's something that was developed here in the state. It had five kind of pilot communities that it worked with, and we're expanding from there to create over 30 of them in the state. So basically, what that means is that each area will have a hub, and that hub can be made up of or led by a hospital, a rural health clinic, a federally qualified health center, an FQHC, or a community health center, as they're commonly known as. And one of them, or potentially a social service agency, could be the lead in that community. And then the goal is then to work with all of the other providers in the area. So in the original torch model that the state rolled out a couple of years ago, it was hospitals that were the lead. Now it might not be a hospital, it could be that FQHC or rural health clinic could potentially take the lead, but then they will be working with other folks in their community. So if a hospital takes the lead, they'll partner with that FQHC or that rural health clinic. But then it would also partner with the food banks, the homeless organizations in their area, transportation services, behavioral health organizations, to really do that wraparound services for the community members. And so really this funding is going to be really community focused. And so one of the things the state of Missouri, as part of their application, really tried to focus on was allowing local control and local decision making. So once the community hubs are set up and they figure out who the lead is going to be in that hub, they will then be offered kind of a suite of services that they could choose from. So stuff that's within the parameters that the federal government has laid out. And then they'll be able to kind of pick. So if in their community they're having a big issue around transportation, so maybe they want to use some of the funding that's been allocated to their hub to increase transportation services. Or maybe housing is an issue there. They could do the same thing. Or school-based health. They're interested in opening a school-based health clinic. And so funding can be focused on that to help do that. So it's really coming down to local control, which I think is the best way to do this at the state level, because each part of the state is very different. What happens in southern Missouri, down in what we call the boot heel area of the state, is very different than what the needs of central Missouri are, or up in the northwest corner, in the St. Joseph area of the state. What they could need as services and the populations that they're serving there are different. And so having a solution that kind of meets all of those needs is a good way forward.
So we know that every state is organizing things differently. And for example, in Alaska, they've said anyone can apply as long as you're providing healthcare to rural communities, and it's not really adopted as in Missouri, where you have the Torch Hospital with the FQHC, the hospital as a hub. How are, if you're a small, say you're a smaller behavioral health provider in a community and you want to engage that hospital or whoever's the leader of the hub, first of all, how do you know who the leader of the hub is? And then secondly, how do you actually get involved? Are you trying to sell to them basically to use you, or are they approaching smaller providers themselves? How does that work?
That's a great question, and we're still figuring all of those things out. So the state of Missouri will be releasing a draft of the hub map about where that's going to be. It's going to have some public input time for that as well. I'm hopeful that these will be all set by hopefully second quarter of this year. At that point, it'll be public information where the hub maps are. So the state of Missouri will release all of that information. So folks who are in a given community, you'll know who was chosen as the hub lead at that point, and how to get involved and who it is. But a lot of the places that they're looking at, they're looking for hubs that already are on the ground in their community. So people who are already doing the work, making those connections already. That's, I think, going to be a priority, to have some of that already laid out, or be groups already kind of thinking through that for what will be the best fit.
Okay, so it sounds like it's about putting yourself out there, being visible, and already collaborating with other providers.
Yeah. And I'm sure, some areas are going to be more developed than others. So I think once those hub maps are released and approved, looking at those and figuring out who your lead is, and then connecting directly with them. The state has been very clear that they expect there to be a full-time staff member who is in charge of each of those hubs. If the person who's in charge, they're a nurse and they're also seeing patients, that's probably not going to work, just because the time commitment that this is going to take for those hubs, in order to be functional and having that. So that's something that I have heard them talk about as a priority, is making sure that it is kind of one person and that's their job, is making those connections in those communities.
Hmm. Okay, we'll see what comes out. It interests me. It's a lot of money. It's kind of, if you think this is what the funding that goes into rural health in Missouri, then it's kind of over these 5 years really peaking up from the baseline. And we've been putting out advertisements telling healthcare providers about this program, and the comments from the public have been quite mixed in terms of their perception of it. A lot of people have said, these are going to be kickbacks to tech companies, or the money's not actually going to go to rural providers, it's going to go to the state who are going to hire more people. Um, how do you, how are you seeing that in Missouri? Is there any tension or optimism or pessimism about if this money will actually reach the the healthcare providers it's intended to reach?
Yeah, I think there's definitely strong feelings on both sides of this about whether or not the money is actually going to, reach the intended targets. I'm very optimistic in the state of Missouri about that. I can't always say that I'm very optimistic, but I think the state has done a really good job on engaging a diverse group of stakeholders as part of the initial application process, and have been clear that they are not interested in all of the money going to, huge urban providers who might offer some services in the rural communities. Yes, obviously they're going to be a part of the conversation, because it is what it is, right? You live in a rural community, you might not have a cardiologist in
Yeah.
your town, so you might have to go to one of the larger city centers in the state, St. Louis, Springfield, Kansas City, in order to see that specialist. So obviously we need to include the larger urban providers in the conversations, but I know that the intent is to try to get it down into the rural communities as best as possible, with that local decision making and local control about
Hmm.
how their particular hub is going to spend the money. So I see that as, kind of a positive direction that the state is going into. Now, of course, some places they're going to want, they have personally asked for hundreds of millions of dollars because they need this and this and this and this and this. The state is taking that all into account. And we haven't actually seen the final budget yet from them. We're expecting to see it in the next couple of weeks for how exactly that money is going to be divided out and who's getting what. But the
Hmm.
state has been very conscientious in making sure that the way the program is set up, that it's not going to just be gobbled up by kind of the huge corporations, that it will get down to the smaller local level.
Yeah, I love how they've taken that into account. It sounds like the model is set up to get the money down, as you said, to the local level
Mhm.
and achieve that real transformation long term. But I'm curious to know, it's a bit of a nebulous term, transformation. You can transform for the better or the worse. What does that actually mean for rural healthcare providers in Missouri, and how can they build something sustainable with these funds should they get them?
Yeah, real transformation in rural healthcare means moving away from constant crisis response, which is how a lot of our healthcare systems have been operating for the last several decades, and towards proactive, intentional systems of care that reflect how rural communities actually function. It includes integrating the physical health, behavioral health, and social support so patients experience kind of a coordinated care rather than fragmentation. So in Missouri, transformation looks like those regional community hubs that coordinate services across providers and counties. And then it's going to be supported by shared data systems and workforce pipelines rooted in those local areas. The goal is to create a system that's stable, adaptable, and resilient, and not perpetually on the brink. So, I think the groundwork is there. Especially like I mentioned at the top of our conversation, the kind of potential cuts coming down from Medicaid that we're all, watching warily for what's going to cause that. We think that this is a way to start setting up systems and having some of that coordinated action that, as that money is cut, as the roles decrease, that there will be kind of a foundation already laid for community connections and really like having service providers working together and really helping each other.
Okay, you think that's not happening enough now, the kind of the interconnection and the
It,
integration?
yeah, it really depends. Like some areas are really good at it already. It depends on the community, and each one has kind of a long history with each
Yeah.
other. And so it really is community by community, whether those systems are already in place or not. Um, like I mentioned, the state has had that pilot torch project in motion for the last several of years. I think that was an excellent case study for them. They learned a lot. The facilities that were involved in it learned a lot, and hoping to make improvements from how it was set up initially. So they're not flying in blind. I
Yeah.
am kind of curious how some of these other states, if it really is they're trying to build a program from the ground up, with the very short timeline that they had in order to come up with a plan. um, at least here in Missouri, we were lucky enough to have kind of a really good model that had already grabbed the attention of the administration. It was specifically called out in the NOFO, in the opportunity whenever it was presented. The
Hmm.
Missouri program was there and was listed as one. So the state really took that and ran with it. And it's going to be interesting to see how that rolls out in every other state as well, and
Yeah.
the problems that they kind of will encounter, especially if they're starting from scratch on a
Yeah.
program.
It's gonna be 50 different stories.
Oh
I
yeah.
I made a little video on LinkedIn in December about Iowa's best and brightest recruitment grant, which they released in December. They're in the process of awarding it according to their timeline. It's $120,000 sign-on bonus for doctors or nurses to move to rural communities.
Hmm.
But all the money has to go to the healthcare provider and instead of the nurse or the doctor. So can't use it for admin costs, can't use it for marketing. And I just got loads of comments from nurses saying, "How do I do this? How do I get this?" But I don't think that sort of scheme, that is for me throwing money at it, because every provider is going to have that bonus. The ones that are awarded it is going to create unfair competition, retention issues.
Yep.
So it's really going to be interesting to see what other states come out with.
Yeah. 100% agree. And throwing money at people doesn't always solve all the problems, right? Like your sign-on bonus is all well and good, but if you're not married and that's a goal of yours, and you can't find a partner in that particular area, right? Like
Mm,
getting
yeah,
involved in the entire community and having it set up so that the social supports are there as well. Like $100,000 signing bonus, while that may be an excellent motivator, that's not necessarily going to encourage people to stay long term.
yeah, yeah. Been there. My
I mean,
wife
I
lives
wouldn't
in the country,
complain
so I know.
about $100,000 signing bonus,
Yeah,
not going to lie, but that's not going to solve all of your problems.
yeah. They could have put a little bit in like a dating night or something like that. um, so we're getting. I told you we're doing ads for this. Most of the respondees are quite small, so maybe 4 to 5 staff members, clinicians on staff, or they're just looking to expand their rural health practice, or they're not a critical access hospital or a FQHC. So it's fine if you base this just on Missouri, but what could providers be doing to prepare for the program now to enhance their capacity to apply whenever grants come out, and just really position themselves at
Mhm.
this early stage so that they could get funded from this?
Yeah, I think one of the biggest things that folks need to think about as they are looking at this program, whether in Missouri or another state, is to avoid treating the Rural Health Transformation Project funding as a short term fix. You know, providers should be focusing on redesigning systems rather than funding temporary solutions. This is really an investment in infrastructure, workforce, care models, data sharing, the big picture things that could really lead to long-term success models. And it should be care models that can be sustained once the funding ends, right? This is a 5-year program. So laying that groundwork so that, when the funding is inevitably gone, to be able to continue to do the work, to show their state legislatures like, hey, this is really worth the investment. The state might not be able to afford such huge amounts of money into this project, but building it in a way that will be sustainable long term. I think that should really be the goal with this is when we see that train coming down the tracks of additional cuts, what can we do to kind of put up barricades to help the local communities survive those? And I think this money will help do that.
Okay, so forward planning for those cuts sounds like it's going to be on a lot of people's minds, but we know the fund isn't meant to make up for those gaps. Is there a tactful way that providers can transform those systems, but at the same time transform them in a way that help alleviate some of the damage that the cuts will create?
Yeah, because it's not a one-to-one, right? Like that's specifically called out in the application that, this money can't be used to replace funds that have been cut. So you can't use it for, your Medicaid patients that are coming in order to fill gaps, right? Like this is really about long-term systems change and reorganization. And so to take it with the spirit of which it was given,
Yeah.
and trying to make the changes the best that they possibly can.
And I think that that's what every state wants to do. They want to help providers. They understand that these cuts are coming in and they can't do much about it. And at the same
There's
time,
always something they can do about it. They can continue to
okay.
advocate with their legislature, with their folks in Congress, to try and stop those cuts coming in the future. But as of right now, you have to live with that reality that might not happen, that those cuts might not be changed in the future. But I do think it is important to say, we all have a voice in this, and we should be arguing and continuing to argue for, those cuts to go away and for the changes. They are in the future. We have time to help mitigate that harm. But we must also operate knowing that might not happen and continuing to, kind of plan for the worst and hope for the best.
Yeah, that's a great correction. Thank you for that. It's important to not forget that.
Advocacy is it holds my heart, right? Like I see
Yeah.
the great work that individuals can do when their voices are being used to the fullest of their capacity. So, I always like to throw in a little bit like,
Yeah.
y'all, it's not totally hopeless. Like you have the ability to help try and change this
Yeah.
so that, folks will maybe see, I think once cuts start happening and hospitals or clinics or health centers start closing, that's going to be a huge eye opener for people. So hope is not lost yet. So
Yeah.
let's keep that
Yeah,
train going.
keep in there. We need you. We need you to be reminding us of that. I wanted to ask also, like, as someone that leads a rural health association, how do you see your role in this whole program? Because there are a lot of organizations out there, nonprofits that support rural healthcare providers, but they're
Yeah.
not really going to be awardees of these grants. So what are you doing, and how could organizations like you support people in their community?
Yeah, so we are very much information sharing about what it is that's going on, what they can expect. We host lunch and learns. We're hoping to ramp those up around this particular issue as more information starts coming out, partnering with the state so that we can continue to kind of spread the word about what's happening and advocating for the inclusion of all of our healthcare partners. So making sure that the rural health clinics, who are usually underutilized in a lot of states, make sure that they're at the table, to make sure our FQHCs are being seen and heard. Our rural hospitals who, they sometimes get drowned out by kind of the large providers in states. These little individual community hospitals, they still have a voice. They are still
Mm.
important. And so being sure that they are at the table, that their voices are being heard, and continuing to advocate for them. So, and our organization does a lot of advocacy at the state level. We work with our National Rural Health Association as well to do advocacy on the federal level. We've been doing a lot more of that this past year simply because of the cuts that have been announced, and then also programs like this that we've wanted to support as well. So making sure that we're at the forefront talking about these, doing podcasts, talking to reporters, getting those connections, getting folks who are actually impacted in front of people who can make a difference,
Mm-hmm.
encouraging our hospitals to talk to media and let them know what the realities actually are. Talking to our rural health clinics, who, a lot of people don't have a ton of knowledge about, and getting them to be more vocal about the impact and the services that they do. So, really trying to keep rural issues at the forefront, make sure the right voices are at the table, and continuing to advocate and amplify
Mm-hmm.
those messages.
Yeah, you can do a lot. I think even if it's just say this program, 218 million being spent in Missouri, if you're just making the execution of it 1 or 2% better, that's creating millions of value for the healthcare providers that are in your orbit.
Yeah.
I I really wanted to close with a little bit of dreaming of the future and to ask you if this 218 million in Missouri is spent super effectively, achieves real transformation. What do you hope that rural healthcare providers and then rural communities will actually feel on the ground by 2031?
Yeah, I think if the Rural Health Transformation Program is successful, rural communities will feel the difference in very tangible ways. Residents will experience more reliable access to care closer to home. There'll be fewer service disruptions and better coordination across those providers. So, like I mentioned, your hospital coordinating with behavioral health, coordinating with homeless support potentially. Those wraparound services, people will really feel that, and it'll mean saved lives. And in Missouri, success looks like stronger regional health systems supported by a stable workforce, integrated physical and behavioral health care, and shared data systems. So, but most importantly, rural Missourians should feel confident that their healthcare systems are resilient and responsive, and that they're built to last, that they're able to weather storms that are coming and will continue to be there for their communities. We lost a lot of hospitals prior to expanding Medicaid in the state, and that has slowed down significantly. So, the idea of trying to build these resilient healthcare systems, so not just one hospital, not just one FQHC, but systems of care that wrap around and
Mm.
that serve communities in a holistic way, that they will be there for the long term.
I'm really interested to see how you and your association support providers do this over the next year or so. And yeah, I think that vision would be shared by all for not just Missouri but every state, that health can be improved and lives are saved. So thank you
Yeah,
so much for sharing that.
absolutely.
And are you putting out any content, or is there anywhere if people want to learn more about what you do, they can reach out to you?
Yeah, they can check us out on our website. Just give us a Google, Missouri Rural Health Association. You'll find us. We are very active community we have going. If you are a rural provider in the state, and that could be anything from the person who's handling your billing and coding to a community health worker to the hospital CEO or an executive director of a outreach program, we have a number of supports available. We also have some active communities available through our Causeway platform, which brings together rural providers. That is free for folks in the state to be able to get on and make those connections with each other, have those conversations, and help troubleshoot problems as well. So we welcome anybody to join us. We also like to get support for our advocacy initiatives as well, because like I mentioned, your voice matters. And so we can help train you on what it takes. It can be a little scary the first time going to talk to legislators. And so we can help you through that, and have those discussions as well and kind of show you the ropes and what it actually takes. Let me tell you a secret though, those legislators, they're not as scary as they seem. They still get up in the morning and put their, the pants on the exact same way that you do. So, people shouldn't have that fear of talking to their legislators, and they're the ones who can really make a difference.
Mm. Okay, they're real people. I didn't know
They're
that.
real people.
Didn't know
Yeah, don't be afraid of them.
that.
Trust me.
Yeah.
Yeah.
Yeah, because when you see someone on the TV or the newspaper, it can be quite intimidating and makes you think, well, what are they gonna listen to me? But that's literally their job
That's
to
literally
listen
his
to
job.
people.
And
Yeah.
working in healthcare all these years, I'm not a provider myself, but I've had the opportunity to work with physicians and nurses and dietary aides and community health workers throughout my career. And they're fearless, right?
Mm,
They go into situations, especially our physicians and nurses, where they have to go in and talk to a stranger every day. And so they make excellent advocates,
mm,
outside of the patient rooms. They are wonderful talking to the legislators just because they're used to it, right? They're used to talking to strangers, diagnosing the problem and offering a solution.
mm.
And that's really all advocacy is diagnosing the problem and advocating
Yeah.
for a solution. And so, we are trying real hard to get more of them involved in it because their voice definitely
Yeah.
matters and they're actually really good at it.
Bring in the fierce charge nurses. Yeah,
So,
well,
yes,
the ER nurses
absolutely.
just yeah, they walk into the beam.
You
There's
don't
like
mess with
10
them.
ER nurses in the flocking behind.
No, no, no. That was one thing I learned as director of the Nurses Association. You don't mess with the nurses.
Yeah. Well, thank you so much for joining, and I wish you all the best. Looking forward to seeing what you can do in Missouri, Heidi. And for those that want to learn more, you can find Heidi at Missouri Rural Health Association, and follow us on the Rural Health Workforce Transformation Hub if you want to explore how you can improve your organization's recruitment and retention into rural communities. Thank you so much, Heidi,
Thank
and
you.
see you soon.